Welcome back to Hoofnotes, where we truly strive to make goat science make sense for all of us. I'm so glad you're joining us today because we're tackling a topic that can bring any goat owner to their knees with worry. You know that gut-wrenching feeling, right? You walk out to the barn and one of your usually vibrant, curious goats just isn't acting right. Maybe they're normally bouncing off the walls, pushing for treats, and now they're just, well, standing there looking dull, maybe even a little hunched. Or worse, maybe they got into something they absolutely shouldn't have, like that temptive bag of feed that was accidentally left open. I remember a time vividly when my neighbor's 4-year-old goat, a sweet, mischievous little doe, somehow managed to get into a whole bag of duck feed. It was a complete nightmare. She went down so fast, became incredibly sick, and the vet later confirmed it was ruminal acidosis. It's one of those scenarios that just strikes fear into the heart of any goat owner because it can be so sudden and, well, so devastating.
It truly is heartbreaking, isn't it? We pour so much love, time, and dedicated effort into our herds, ensuring they're happy, healthy, and thriving. And then something unexpected like this happens, often something we could have potentially prevented if we'd just understood the underlying mechanisms a bit better. It makes you really wonder what's going on inside their incredibly unique and, frankly, complex digestive system when things go so wrong so quickly. Today, we're going to try and pull back the curtain on one of the most critical digestive issues our goats can face, helping you understand the why behind the what.
Absolutely. Today, our deep dive is all about ruminal acidosis. You might also hear it called grain overload, which is honestly a pretty accurate description of its most common cause. It's a serious, potentially fatal condition, but as with so many things in life, understanding it is your very first and probably most powerful step in protecting your herd. Knowing what's happening and why really empowers you to take action.
Yeah, exactly. Our mission today is to truly demystify ruminal acidosis. We'll explore exactly what causes it, how to recognize the symptoms, from those subtle, easy to miss signs that can often be overlooked, to the really severe emergency situations that demand immediate attention. We'll also cover what the necessary treatments are should the worst happen. And perhaps most importantly for us as goat owners, we'll give you actionable, practical strategies to prevent it from happening in the first place. We know that many of you, like us, are dedicated goat owners who might not have a deep scientific background, so we're going to break down the goat science and hopefully make it genuinely make sense for your everyday barn life.
And to bring you this comprehensive deep dive, we've carefully pulled insights from a wide variety of incredibly reliable sources. We've looked at real-world advice from veterinary Ask a Vet columns, practical, easy-to-understand guides from university extension offices, the kind that are truly designed for livestock owners. And we've even delved into some cutting-edge scientific research on newer treatments, like those using sophisticated carbonate buffer mixtures. This approach ensures you're getting a well-rounded, evidence-based understanding of this condition, covering both the hands-on stuff and the scientific underpinnings.
It's all about giving you the full picture, right? Grounded in the most current and reliable information available. Our goal is just to translate that science into practical knowledge for your farm.
Right. Now, before we plunge in all the nitty-gritty details, a vital reminder, and this is truly important. The insights and information we're sharing today are for educational purposes only. They're designed to help you understand a complex condition, but they're absolutely not a substitute for professional veterinary advice. For any specific health concerns, for diagnosis, or for crafting specific treatment plans for your herd, always, always consult your veterinarian. They are truly your best resource and partner in keeping your goats healthy and safe. This is just crucial for the well-being of your animals. Okay, let's dive right in. So we've set the stage with this dangerous condition, but let's get down to basics. What exactly is ruminal acidosis? Can you help us picture what's happening inside our goat when this hits?
Absolutely. At its core, ruminal acidosis is basically an abnormal, dangerously acidic environment that develops within a goat's rumen. For those new to goat anatomy, the rumen is like their first and largest stomach compartment. It's essentially a giant fermentation chamber. You know how we talk about pH balance in human health, whether it's for our skin or our diet? Well, it's just as crucial, maybe even more so, for goats and their unique digestive system.
So if I'm picturing my goat's rumen, I imagine it as this finely tuned fermentation vat, right? It's like a bustling city of trillions of tiny microbes, each with its own specialized job, working incredibly hard to break down all that tough fiber, like the hay and pasture they eat. But imagine if that vibrant city suddenly flooded with a sour, corrosive liquid, a really strong acid, much stronger than anything that should normally be there. That's essentially what acidosis feels like for a goat. It completely disrupts that delicate balance, essentially poisoning the microbial population, right?
That's a perfect analogy, really good way to put it. Normally, a healthy goat's rumen maintains a pH range of approximately 6.0 to 7.0. To put that into perspective, pure water is pH 7.0, so a healthy rumen is actually slightly less acidic than pure water. This specific range is absolutely ideal for the beneficial fiber-digesting bacteria, often simply called fiber digesters or, the good bugs. These are the ones that are essential for breaking down hay, grasses, and other forage. However, in acidosis, this pH drops significantly, often falling below 5.5, which is quite acidic. In severe cases, we've seen it plummet to as low as 3 to 5. That's an extremely corrosive environment. That's a drastic and rapid change, and it has profound, devastating effects on the entire system, both within the rumen and really throughout the goat's body.
Okay, so what usually triggers this drastic and dangerous pH drop? What are the common culprits we, as diligent goat owners, really need to be on the lookout for in our barns and pastures?
Well, the primary trigger is almost always a sudden and excessive consumption of what we call rapidly fermentable carbohydrates. Now, that might sound technical, but it simply means anything that the rumen microbes can break down extremely quickly, producing a lot of acid in the process.
And when we talk about rapidly fermentable carbohydrates, the first thing that probably leaps to mind for many of us is grain overload. Common culprits certainly include familiar feeds like corn, oats, wheat, and barley. It's particularly problematic if these grains are finely ground, like that duck feed my neighbor's goat got into, because the smaller particle size means the bacteria have more surface area to work on, so they can ferment them even faster, creating an even quicker and more severe acid surge. But it's not just your typical bag of goat or livestock grain we need to worry about, is it? We've seen countless cases of acidosis triggered by unexpected indulgences. Think about items like breads, rice, even large amounts of sweet fruits like apples or grapes. Then there are things like sugar beets, potatoes, and surprisingly, bakery waste products. Basically, anything that contains a lot of simple sugars or starches. Incompletely fermented brewery products are another less common but potent source. And even something seemingly innocent, like unrestricted access to standing green corn in a field, can be a problem if a goat gorges on it. Believe it or not, I've even heard of cases caused by excessive amounts of animal crackers given by owners as treats, which really highlights that it's the amount and type of carbohydrate that's the danger, not just the source itself.
That's exactly right. It's any readily fermentable carbohydrate that's consumed in large amounts, especially when the rumen just isn't prepared for it. Beyond these accidental incidents, there are other very common scenarios that can lead to acidosis. For instance, even if your goat is already accustomed to a high-grain diet, a rapid or drastic increase in the amount of grain you're feeding can overwhelm their system. We often see this when producers quickly try to boost milk production or weight gain without a slow, gradual transition. Another common scenario is interrupted access to feed. If goats are denied grain for a period, maybe due to bad weather delaying delivery, a particular stage of pregnancy where their diet changes, or simply empty feeders for a day, and then suddenly get full access again, they tend to gorge themselves. This sudden, large intake of carbohydrates can be just as damaging as an accidental ingestion. We also need to consider mixing errors, like when buffering agents, like baking soda or other antacids, are accidentally left out of a prepared feed ration, removing that protective measure. And finally, competition at the feed bunk can play a significant role. If there isn't enough bunk space for all goats to eat comfortably at the same time, some dominant animals might eat aggressively and overconsume their share, leading to acidosis in those individuals, while the less dominant ones get shortchanged.
Okay, let's unpack this a little more. You mentioned it's a biological cascade. What precisely happens inside that delicate rumen when it's suddenly overwhelmed by all these carbohydrates? It sounds like a series of unfortunate dominoes falling, one after another.
It absolutely is. It's a rapid and intricate biological cascade that begins with what we call a bacterial blitz. The moment that rapid influx of easily digestible carbohydrates hits the rumen, it causes a massive, immediate explosion in the population of starch-digesting bacteria, most notably a type called Streptococcus bovis. These microbes are incredibly efficient at their job, and as they ferment all that sugar and starch, they quickly produce large amounts of lactic acid as a byproduct.
And that's where the pH crash really starts, right? This new acid just overwhelms everything else that's going on in there.
Yeah, precisely. Lactic acid is a much stronger acid compared to the normal beneficial acids, the volatile fatty acids, or VFAs, that are typically produced in a healthy rumen. This means it causes a much sharper and more significant drop in pH. This increasingly acidic environment quickly becomes hostile and, frankly, toxic to the beneficial, acid-intolerant, fiber-digesting microbes, those good bugs that thrive in a higher, more neutral pH. They begin to die off in large numbers, often within just a few hours. As the pH continues to fall, typically below 4.5, a different group of bacteria, the acid-tolerant species, particularly those in the lactobacillus family, start to take over. And what do they produce? Even more lactic acid, which further drives down the pH, creating this vicious, self-perpetuating cycle where the bad acid-producing bacteria just completely dominate.
So it's a vicious cycle where the bad guys take over and make things even worse, kind of like a sour, bubbly mess inside.
Mhm.
And you mentioned there are two types of lactic acid. Why does that distinction matter for our goats?
That's a crucial point, and here's where it gets really interesting for understanding the full impact. There are two forms, or isomers, of lactic acid, L-lactate and D-lactate. Now, while L-lactate is relatively easily metabolized and cleared by the goat's own body, D-lactate is not. The goat system really struggles to process it. It accumulates rapidly, first in the rumen, then it starts leaking into the bloodstream, contributing significantly to a dangerous condition called systemic acidosis, which impacts the entire body. This is why a simple grain overload can become a full-body emergency so quickly. It's not just a bellyache or digestive upset confined to the rumen, it's a systemic crisis where the animal's entire physiology is thrown completely off balance.
So we have this building acid problem. But it's not just the acid itself causing damage, is it? There's also something dramatic happening with fluids inside the goat, something I've heard called a fluid shift. Can you explain what that means?
You're absolutely right. As these acids and other breakdown products build up within the rumen, they make the rumen incredibly thirsty. Osmotically active is the technical term. It starts acting like a giant absorbent sponge. What happens is that it pulls massive amounts of fluid, including precious water and vital electrolytes, directly from the goat's bloodstream and other tissues into the rumen itself. Imagine your goat's entire body becoming dehydrated because all its fluid is being sucked into its stomach. This leads to severe, life-threatening dehydration, which can quickly progress to a state of shock, where the goat's blood volume is dangerously low and its organs aren't getting enough blood flow.
So their body is literally drying out from the inside because the rumen is hogging all the water. That's a truly terrifying thought.
It's a very accurate and stark way to put it, yes. And at the same time, this highly acidic lactic acid is incredibly corrosive. It severely damages the delicate rumen lining, causing ulcers and widespread inflammation. We call this ruminitis. This damage to the rumen wall makes it permeable, almost like a sieve with holes punched in it. This allows harmful bacteria like Fusobacterium necrophorum and dangerous toxins, specifically lipopolysaccharides or LPS, which are released from dying gram-negative bacteria to leak directly into the bloodstream. Other deleterious compounds like histamine, which can cause severe allergic-like reactions, also accumulate and can be absorbed into circulation through that damaged wall.
And when these toxins and bacteria leak into the bloodstream, that's when you start seeing effects throughout the entire goat, not just the digestive system, right? So this isn't just about the gut anymore, it's a whole body catastrophe unfolding.
Precisely. These leaked toxins trigger a widespread, severe inflammatory response throughout the goat's body. They cause an increase in specific inflammatory chemicals, cytokines like TNF-alpha and IL-1 beta. This systemic inflammation can lead to severe consequences, potentially a collapse of the cardiovascular system, leading to reduced blood flow to vital tissues and organs, and impaired kidney function, which can result in anuria, meaning the goat stops producing urine altogether. And what's particularly relevant for our dairy goat owners listening is how these metabolic disturbances also directly affect milk production. You'll often see a significant and noticeable reduction in milk fat and lactose synthesis because the goat's body is basically redirecting all its available nutrients and energy to fight the widespread inflammation and try to survive, rather than supporting mammary gland function. This raises an important question for our dairy goat owners. If your milk fat levels suddenly drop without a clear explanation, it's definitely a red flag. It's often one of the first and most noticeable signs of a problem like SARA, even before other clinical signs are really obvious.
So now that we have a clearer picture of the why behind ruminal acidosis, let's talk about the what to look for. As you mentioned earlier, acidosis isn't always a dramatic collapse. It can show up in different ways. This is crucial for early intervention, isn't it?
That's a really critical point for all goat owners because recognizing the signs early can literally mean the difference between life and death, or at least between a minor setback and a major emergency. We generally classify acidosis into three distinct forms, ranging from subtle and easy to miss to immediately life-threatening. The first is subacute ruminal acidosis, or SARA, S-A-R-A. This is truly the hidden threat because it often goes unnoticed, especially in busy herds or if you're not looking really closely. Goats affected by SARA may initially remain quite bright, alert, and responsive. You might not even realize something serious is happening just by looking at them walking around.
So you might not even realize something serious is happening. This is where it's so tricky, because they don't look desperately ill right away.
Exactly. The signs are often subtle and nonspecific, meaning they could easily be attributed to other things. You might notice transient anorexia, which just means they go off feed for a short period, or maybe just a general slight decrease in their overall feed intake. Their feces might be inconsistent, sometimes a bit loose, sometimes normal. You might also observe reduced cud chewing, or maybe altered rumen motility, meaning their rumen just isn't churning as actively as it should. For meat goats, you might see poor weight gain or just them not thriving as expected, which again can be easily attributed to other factors like parasites or maybe poor feed quality. But here's a huge insight for our dairy goat owners. The most notable sign of Sarah, and one that many of us might just tolerate as summer slump milk or a bad day, is depressed butterfat levels. If you're noticing a consistent dip in butterfat and just chalking it up to seasonal changes, pause. Think again. This could be your herd's subtle early warning sign of Sarah. It's an indicator that something is off before it becomes an obvious illness, giving you a chance to intervene early, potentially before other, more severe symptoms appear.
That's an incredible insight. Wow. So if you're seeing those subtle signs, especially that butterfat drop, it's your early warning system. It's your herd trying to tell you something's off before it turns into a full-blown emergency. What happens as it progresses to the next stage?
And that's why paying attention to those nuanced changes is so crucial. Because left unaddressed, Sarah can lead to chronic, long-term problems. Things like chronic hoof problems, specifically laminitis, often called founder. While it's more commonly discussed in sheep and cattle, it can definitely still affect goats, leading to painful lameness and chronic hoof issues that just don't seem to resolve. You can also see complications like liver abscesses, mastitis, which are udder infections, and endometritis, which are uterine infections. Moving on to acute ruminal acidosis. This is the emergency phase. This is when things get serious fast. Clinical signs typically appear within 12 to 36 hours after the goat consumes the offending feed, and they are much more obvious and alarming than Sarah.
Okay, this sounds much more alarming. What should we be looking for if we suspect acute acidosis? What are the immediate red flags that scream emergency?
Well, the initial signs usually include a sudden and complete loss of appetite, known as anorexia, coupled with profound depression and generalized weakness. They just look miserable. You'll almost always notice bloat, with a visibly distended left abdomen. It might look tight, like a drum. If you gently press on their left flank or listen with a stethoscope, you might hear a characteristic fluid splashing sound due to the excessive watery contents in the rumen, almost like a water balloon sloshing around in there. They'll likely have profuse, watery, foul-smelling diarrhea, which can often be gray and might even contain undigested grain particles or sometimes even frank blood. Rumen contractions, which you can normally feel as gentle pushes on the left flank if you rest your hand there, will be weak or completely absent. The gut has basically shut down.
And then it starts impacting the whole body, beyond just the gut, right? The dehydration and shock you mentioned earlier.
Yes, the signs of systemic shock become painfully evident quite quickly. You'll see severe dehydration, indicated by sunken eyes, a prolonged skin tent, where the skin stays tented up for several seconds when you pinch it rather than snapping back quickly, and delayed jugular filling, meaning the vein takes a while to refill after you press on it. Their peripheral pulses, like maybe in their leg, will be weak and thready, hard to find, and their extremities, like their ears or legs, might feel cold to the touch. Their heart rate will be significantly increased, a condition called tachycardia, beating really fast, and their breathing will be rapid and shallow, known as tachypnea. Neurological signs are also common and quite distressing to see. These can include extreme dullness or unresponsiveness, staggering or unsteadiness on their feet, ataxia, head pressing against walls or fences as if in pain, apparent blindness, seizures, and even epistotonus, which is that dramatic stargazing position where their head and neck are arched rigidly backward. A useful test your vet might perform is evaluating the blink reflex, the palpebral reflex. Its depression, or lack of blinking, correlates directly with the severity of the dangerous D-lactic acidosis building up. You might also notice them grinding their teeth, which is a clear sign of pain due to the chemical ruminitis, that inflammation of the rumen lining caused by the acid. While initially they might have a slightly increased rectal temperature, this often progresses to hypothermia, a low body temperature, in later stages as their body systems begin to shut down.
That sounds absolutely terrifying, like something out of a horror movie for a goat owner. Just watching your animal go through that. And then there's the worst case scenario you mentioned.
Unfortunately, yes. The third and most severe form is peracute ruminal acidosis, which can lead to sudden death, often with very little warning. Animals may simply be found dead with few or no prior signs of illness observed. They just collapse without warning. In some instances, they might be found lying down, unable to get up, recumbent, and in a coma, perhaps with their head tucked into their flank. The progression is extremely rapid, and the prognosis is generally very, very poor, with death often occurring within just a few hours of the overload. This is truly the most devastating outcome.
Wow. Beyond the immediate obvious clinical signs we just discussed, what are some of the unseen damages or associated complications that acidosis can lead to, even if a goat seems to recover from the initial event? It sounds like there could be lasting impacts we need to watch for.
That's a crucial point, because even a goat that survives the acute phase isn't necessarily out of the woods completely. Acidosis can lead to a host of secondary problems, often weeks or even months down the line. One of the most common is liver abscesses. That damaged rumen wall allows harmful bacteria like Fusobacterium necrophorum to leak into the bloodstream and travel directly to the liver via the portal vein, where they can set up shop and form painful, pus-filled pockets. These can cause chronic illness and poor performance. Another significant complication is laminitis, often called founder. This is an inflammation of the sensitive laminae, the structures that support the hoof wall, leading to severe pain and lameness. While it's perhaps more commonly seen or talked about in horses and cattle, it can definitely still affect goats, leading to chronic hoof problems and recurring lameness that's difficult to manage.
I've always heard of laminitis with horses. It's fascinating and kind of scary that it can impact goats too, even if less frequently. It just shows how interconnected everything is in their bodies, doesn't it?
Indeed. It's really a testament to the systemic impact of acidosis. It's not just a gut issue. Another serious neurological condition that can arise is polioencephalomalacia, or PEM. This is caused by a thiamine, or vitamin B1, deficiency, which is directly linked to the disruption of the rumen microbes during acidosis. The radical changes in the rumen environment can either destroy the beneficial bacteria that produce thiamine, or alternatively increase the activity of enzymes called thiaminases that break down thiamine. When thiamine levels plummet, it directly affects the brain, causing swelling and damage, leading to those neurological signs.
So it's not just a gut problem. It literally affects their brain function. That's shocking. It really highlights how dependent they are on those rumen microbes for essential nutrients.
Exactly. It's a systemic issue that impacts the central nervous system directly. Other complications can include mycotic ruminitis or omositis, which are basically fungal infections that can take hold in the damaged stomach linings when the normal bacterial balance is disrupted and the tissue is compromised. We can also see enterotoxemia, often colloquially called overeating disease, because the altered gut environment can allow certain Clostridium bacteria to proliferate rapidly and produce potent toxins. Urinary calculi, or stones, are a particular concern in wethers and pet bucks, especially those on diets with excessive grain intake, as the mineral imbalances caused by high grain diets predispose them to stone formation in their urinary tracts, which can be fatal if blocked. And finally, conditions like mastitis, udder infections, and endometritis, uterine infections, can also be linked back to the systemic inflammation and stress caused by an acidotic event, as the body's immune system is compromised and resources are diverted.
We truly cannot stress this enough. Ruminal acidosis is a veterinary emergency. If you even suspect it in your goat, call your vet immediately, no matter the time of day or night. But knowing what they're looking for and how they approach diagnosis and treatment can really help us as owners understand the situation better and be prepared for what's involved.
Absolutely. When your vet arrives, the first thing they'll do is take a thorough history from you and perform a careful clinical examination, assessing the signs you've observed in your goat. They'll want to know exactly what feed was consumed, if known, how much, and what symptoms are present and for how long. This information is absolutely key, as it guides their entire diagnostic process. The single most useful diagnostic tool for confirming acidosis is a rumen fluid analysis.
How exactly do they collect that rumen fluid? Is it a difficult or invasive process for the goat? I imagine sticking a tube down their throat isn't pleasant.
It can be collected in a couple of primary ways. Most commonly, it's done via an rumen tube, which is a flexible tube passed carefully down the esophagus into the rumen. With proper technique and maybe some gentle restraint, it's generally well tolerated by the goat. Less commonly, perhaps for specific cases or if tubing isn't possible, they might collect a sample with a needle directly through the flank wall into the rumen, a procedure called a ruminal paracentesis. Once collected, the vet will immediately evaluate the fluid's appearance and smell. In an acidotic goat, the fluid will often appear milky gray or yellowish gray, very watery in consistency, and have a distinctly sour or even putrid odor, very different from the brownish green, slightly aromatic fluid of a healthy rumen. The critical test, though, is measuring the pH of that fluid right away, usually with pH paper or a portable meter. A rumen fluid pH of less than 5.5 confirms the diagnosis of acidosis. As we mentioned, in severe cases, the pH can actually be between 3 and 5, indicating extreme acidity. Microscopically, under a microscope slide, the vet will also look for decreased numbers or even a complete absence of the larger protozoa, which are normally abundant and actively moving in healthy rumen fluid. They'll also observe a noticeable shift towards predominantly gram-positive bacteria, which is characteristic of those acid-producing bugs taking over.
Okay, so the rumen fluid gives a direct window into what's happening. Beyond that, what other tests might the vet run to get a full picture of what's happening internally, systemically?
They might also recommend blood work and other laboratory tests to assess the whole body impact. They'll likely run a complete blood count, CBC, which can indicate the degree of dehydration. The PEC cell volume might be high, and show signs of inflammation throughout the body via changes in white blood cell counts. A serum or plasma biochemical profile is incredibly useful. It helps evaluate organ function, checking if the liver or kidneys are being damaged, and it spots electrolyte imbalances, which are common with dehydration. It will also help assess the severity of the metabolic acidosis that impacts the entire body, not just the rumen, by looking at things like bicarbonate levels. Plasma lactate levels, in particular, will likely be elevated, directly reflecting that D-lactate building up in the system, which we talked about being hard for the goat to clear. Finally, your analysis, a urine test, may show aciduria, meaning acidic urine, which is the body's attempt to excrete some of that excess acid, though kidney function might be compromised too.
Knowing what treatments your vet might recommend can really help us as owners understand the severity of the condition and maybe the long road to recovery for our goat. What's the typical multi-pronged approach they'll take to fight this?
Treatment is indeed a multi-pronged approach, often needing several things done simultaneously to reverse the damage and support the goat. The first and most vital step is correcting the severe dehydration and shock through aggressive fluid therapy. For severe cases, intravenous or IV, fluids are absolutely essential. They might use balanced electrolyte solutions like Ringer's lactate or normal saline, given rapidly to restore blood volume and tissue perfusion. For very rapid plasma volume expansion, especially in severely shocked animals, your vet might initially use a small volume of hypertonic saline solution that pulls water into the bloodstream quickly. But it's crucial to remember these effects are temporary and must be followed up with large volumes of isotonic fluids like Ringer's. For milder cases, or as follow-up once the goat is more stable and can swallow safely, oral fluids and drenches containing electrolytes are very important.
So getting fluids in them is absolutely paramount. Job number one. What about neutralizing that dangerous acid itself? That's the core problem, right? How do they tackle that?
That's the next critical step, neutralizing the acid using alkalinizing agents or buffers. For oral administration via that stomach tube, a product like magnesium hydroxide, like milk of magnesia but veterinary grade, is generally preferred, given at about 1 gram per kilogram of body weight. It acts as an effective antacid. It's important to note again why common baking soda or sodium bicarbonate is generally not the best choice for oral drenching in highly acidic situations like this. It can cause significant bloat due to the rapid release of carbon dioxide gas when it reacts with the strong acid in the rumen, potentially making the bloat worse, which is already often a problem. However, intravenous sodium bicarbonate is used and often critically needed for systemic acidosis, carefully calculated and administered directly into the bloodstream to neutralize the acid that is spread throughout the body and bring the blood pH back towards normal.
That's a really good distinction, oral magnesium hydroxide. But IV for the bicarbonate, if needed systemically. And I heard you mention earlier some newer research on a different kind of buffer that's really promising, especially maybe for those less severe SARA cases.
Yes, that's a fascinating and very promising area of research, particularly for tackling SARA. There's new work on a specific carbonate buffer mixture, often abbreviated as CBM. This special mixture contains compounds like sodium carbonate, sodium bicarbonate, magnesium sulfate, and potassium chloride, all working together. Studies have shown that CBM can rapidly elevate rumen pH within just 6 hours of treatment, bringing it back into a healthier range much faster than some other methods might. Crucially, it also seems to reduce circulating endotoxins, those dangerous LPS toxins we talked about leaking from the gut, and helps restore the rumen's microbial balance, encouraging the beneficial bacteria to bounce back. It truly seems to offer a multidimensional therapeutic effect by addressing both the immediate pH problem and the underlying microbial disruption, hopefully helping the goat recover faster and more completely.
That's really promising for severe cases, and maybe for helping manage the overall systemic impact, even in acute cases. What about restoring that whole rumen environment after it's been so devastated, especially if the good bacteria had been wiped out? How do you rebuild that internal city?
Restoring the rumen microenvironment is absolutely essential for long-term recovery and getting the goat back to digesting normally. One option, though less common in goats compared to cattle, is rumen lavage. This involves flushing the rumen with large volumes of warm water through a large bore tube to physically wash out some of the acidic contents and offending feed. For very severe cases, especially in high-value animals where the rumen is just packed with grain, a rumenotomy might be performed. This is a major surgical procedure where the vet physically opens the rumen through the flank and manually removes the contents. It's invasive, but can be life-saving in extreme situations. But for many cases, and often the most impactful approach for reestablishing healthy function, is rumen transformation.
That's where you basically give them a super probiotic boost, right? Like a transplant of gut microbes from a healthy goat.
Exactly. You literally transfer rumen fluid collected via tube from a healthy donor goat or even a healthy cow, as healthy cow rumen fluid can also be effective to the affected goat, again, usually via stomach tube. Typically, about 2 to 4 liters are used for small ruminants, like goats. This is like a massive, immediate infusion of those vital beneficial microbes, bacteria, protozoa, fungi back into the damaged rumen. It helps to kickstart its function, reestablish a healthy microbial population much faster than it could on its own, and resume proper digestion. It's a truly powerful therapeutic tool for recovery.
That makes so much sense, repopulating the workforce, essentially.
Right.
And what about managing the other complications that can pop up, like those liver abscesses or brain issues, the PEM you mentioned earlier? Are there specific treatments for those?
Yes. Ancillary therapies are crucial for managing those potential secondary issues and supporting the goat's overall recovery process. Thiamine, or vitamin B1, is absolutely critical for preventing or treating polioencephalomalacia, or PEM, the neurological condition we discussed. The suggested dose is around 10 milligrams per kilogram of body weight, given by injection, IM or SC, every 8 hours for about 3 days to protect the brain and nervous system from damage due to thiamine deficiency. Injectable antibiotics like oxytetracycline or procaine penicillin G may be used parenterally, by injection, not orally, to help prevent secondary bacterial infections like those liver abscesses caused by bacteria like Fusobacterium necrophorum that escape the damaged rumen. Again, it's very important to note that oral penicillin is generally not recommended as it can further harm the remaining beneficial rumen microbes we're trying to save. Anti-inflammatories, such as NSAIDs like meloxicam, can be used to manage pain, reduce fever, and help control the widespread inflammation throughout the body. Antihistamines, like diphenhydramine or phenyramine maleate, can also be given to counteract some of the toxic effects of compounds like histamine that are released during severe acidosis. And finally, multivitamins and potentially supplements designed to stimulate rumen function, rumen torics, might also be part of the treatment protocol to support overall health and aid recovery.
Wow, it really sounds like a lot goes into getting a goat back on track after a bout of acidosis. It's intensive care, really. So, what's the overall prognosis for a goat that experiences ruminal acidosis, especially with all these intensive treatments? Is it generally a good outcome, or is it really touch and go?
That's a crucial question for any owner facing this situation, and understandably so. The prognosis depends very heavily on how quickly the acidosis is recognized and, crucially, how quickly effective veterinary treatment begins. The initial severity of the condition is also a major factor. Factors that generally indicate a poorer prognosis include things like a blood pH less than 7.2, severe systemic acidosis, a rumen pH less than 4.5, extreme rumen acidity, the presence of severe central nervous system signs like persistent blindness or uncontrolled seizures, or if the goat stops producing urine, and anuria, which indicates severe kidney impairment and likely systemic collapse. As we mentioned earlier, peracute cases where death is very sudden sadly rarely survive despite even rapid intervention. However, and this is truly the good news and a point of hope, with prompt and correct veterinary intervention, studies actually show a remarkably high recovery rate for acute cases. One specific investigation we looked at found that a remarkable 98.21% of treated goats recovered completely within about 3 days, with a very low mortality rate of just 1.78% in that study group. This really underscores the critical importance of early detection and immediate veterinary care. Don't wait and see. Don't hesitate. Calling your vet quickly can absolutely make all the difference between recovery and a tragic outcome.
That's actually really encouraging to hear that the recovery rates can be so high with fast action. So what does this all mean for us as goat owners in our day-to-day management? It really sounds like prevention is truly your best defense against acidosis.
Yeah.
It emphasizes being proactive, doesn't it, rather than reactive.
It absolutely is the cornerstone of keeping your goats safe and sound from this condition. When it comes to mindful feeding, which is your primary line of defense, the most important piece of advice is gradual introduction. Any new concentrate feeds or any increases in the amount of grain you're currently feeding should be introduced very slowly, ideally over a 2 to 3 week period. This isn't just a suggestion, it's vital because it gives your goats, rumen microbes, the internal ecosystem, the necessary time to adjust their populations and adapt to the new feed source or amount without crashing the entire delicate system. If you change things too fast, you risk overwhelming them and triggering acidosis.
So no sudden changes to the feed plan. That's a big one. I'm definitely guilty of sometimes trying to transition too quickly, especially when maybe trying to boost milk production. It's such a common mistake, often born out of good intentions, but potentially dangerous.
We all can be tempted, and it's a very common mistake. Another crucial tip is to always feed long-stem hay before offering grain. This simple practice helps fill the rumen with fiber first. It slows down the rate at which the subsequent grain is fermented, and, importantly, it encourages cud chewing. And cud chewing produces a lot of saliva, and saliva is a goat's natural rumen buffer containing bicarbonates that help neutralize acid as it's produced, so more chewing equals more buffering. You also need to ensure balanced rations, meaning a minimum of roughly 40–60% roughage, hay, browse, good pasture, in their total diet. Remember, goats are natural browsers. They inherently prefer brush, leaves, and broadleaf weeds, often called forbs, over just grazing grass like sheep or cattle. This natural browsing behavior inherently stimulates chewing and saliva production, keeping the rumen healthy.
And I imagine the amounts we feed are critically important too, not just the type of feed or the timing. Getting that right must be key.
Absolutely crucial. You need to tailor concentrate amounts precisely to the goat's individual production stage. Whether they are growing kids, pregnant does in late gestation, or lactating does at peak production, as their energy requirements vary greatly throughout their life cycle. For goats that do require higher concentrate diets, like high-producing dairy does, it's always best to give smaller, more frequent meals, ideally 3 or more times a day if possible, rather than 1 or 2 large grain meals. This helps prevent overwhelming the rumen at any one time and allows the microbes to process the feed in more manageable batches. Also, please remember that treats are treats, not meals. Dry does, wethers, castrated males, and non-breeding bucks generally don't need concentrates for their basic nutritional needs if they have good quality forage. Those handfuls of grain you might give as treats to your friendly pet wethers. Too much can actually significantly increase their risk of developing painful urinary stones or calculi, so please proceed with caution and strict moderation. And critically, perhaps most importantly for preventing accidental overload, do not store grain, bread, biscuits, chicken feed, duck feed, or any other highly fermentable products where goats can possibly access them. Goats are incredibly clever and curious escape artists. If there's a way into a feed bin or bag, a determined goat will find it. Secure, goat-proof storage is absolutely non-negotiable.
That's such a good point about the wethers and treats. It's easy to overdo it out of affection. And the secure storage. Yeah, lesson learned the hard way sometimes. It's not just what they eat, but how they eat it and their environment that makes a difference, right? So beyond the feed bucket itself, what management practices should we be focusing on to minimize risk?
That's right. The environment and herd management practices play a huge role in preventing acidosis, often indirectly. First, ensure you have adequate bunk space for your herd. The general recommendation is about 16 inches of linear space per goat at the feed bunk. This helps prevent competition and aggressive eating behavior, which can lead to some dominant goats gorging themselves while timid ones get pushed away and don't get enough. Consistent feeding times are also important for establishing a stable digestive rhythm. Goats, like many animals, thrive on routine. Forage management is key too. Always try to feed hay in mangers or feeders with troughs underneath to reduce waste and, importantly, limit fecal contamination and parasite exposure. Also, be aware that certain types of feeders, like some large round bale feeders, might inadvertently limit access to the most desirable parts of the forage for smaller or less dominant goats, potentially leading to lower overall roughage intake for those individuals. You might think the feeder is full, but your picky or smaller goat can't reach the good stuff inside, so they eat less roughage overall, which makes them more vulnerable if they then fill up on grain.
That's a great point I hadn't really considered. The feeder looks full, but they're still not getting the quality forage they need, meaning they might overcompensate elsewhere, like at the grain trough.
Exactly. And speaking of forage quality, forage testing through your local extension office or a private lab is really the only way to truly know the nutritional quality of your hay or pasture. This allows you to accurately balance the ration and fill any nutritional gaps with appropriate supplements rather than just guessing or potentially overfeeding concentrates unnecessarily. And never ever underestimate the power of clean water. Provide free access to clean, fresh water at all times. Water intake drives feed intake and vice versa. If they don't drink enough, perhaps because the water is dirty or frozen, they might eat less forage, which can lead them to consume relatively more grain and increase their risk of acidosis. Finally, heat stress mitigation is vital, especially in summer. Keep goats as cool as possible during hot weather using shade, fans, or misters, as heat stress can significantly reduce their appetite, particularly for forage. When forage intake drops due to heat, they become more reliant on concentrates, again increasing the risk. Adjusting feeding management across seasons is therefore very important to keep their rumens balanced and happy.
That makes sense. Heat makes them less interested in working hard to eat hay. Okay, so those are great management tips. Are there any allies in our fight against acidosis that we can actively add to their diet? Sort of like a preventative supplement that can help buffer their system proactively.
Absolutely. There are a few supportive supplements that can make a big difference, especially if you're feeding any amount of concentrates as part of your goat's diet. Always make free choice baking soda, sodium bicarbonate, available in a separate feeder away from the main minerals. This acts as a self-serve buffer. Goats will often consume it when they feel their rumen pH dropping, helping to neutralize excess acid as it's produced throughout the day. You should also offer free choice mineral supplements specifically formulated for goats, not sheep or general livestock minerals. These goat-specific mixes are balanced for their needs and often contain buffering agents like magnesium oxide or sodium bicarbonate, along with other essential nutrients like calcium, phosphorus, copper, and selenium that support overall health and rumen function. And finally, consider feed additives like certain yeast cultures. Specific strains of live yeast or yeast culture products have been shown in studies to help improve fiber digestion and stabilize the rumen microbiota. They can promote the growth of beneficial bacteria and actually help reduce the populations of harmful ones like the lactic acid producers. This contributes to a healthier, more resilient rumen environment overall, making it less susceptible to drastic pH drops when dietary challenges occur.
Fantastic. So free choice bicarb, goat-specific minerals, and maybe yeast cultures are good tools in our prevention toolbox.
Okay, so we've taken a truly comprehensive journey through ruminal acidosis today. We've really tried to understand its complex physiological causes, that whole cascade effect. We've learned how to recognize the varied clinical signs, from that sneaky, subtle SARA to the acute, life-threatening emergencies. We've covered the veterinary treatment options, emphasizing how critical rapid intervention is. And most importantly, we've focused on implementing robust preventative measures through careful dietary and herd management.
And to reiterate, because it bears repeating, ruminal acidosis is primarily a management-related problem. It's usually caused by improper feeding practices, whether accidental or intentional. This really emphasizes the profound power you as goat owners have in preventing it. A strong understanding of your goat's unique digestive system and applying careful, consistent dietary practices are truly the cornerstones of prevention. By being aware and proactive, you can significantly safeguard your herd from this potentially devastating condition. Your goat's rumen is so much more than just a stomach. It's this bustling, incredibly sensitive ecosystem that truly dictates their overall health and well-being. Our deep dive today really shows just how intricately connected diet is to every single aspect of their health. So as you head out to your barn later today and look at your beloved animals, maybe consider this. What one small, intentional dietary adjustment or management tweak could you make this week to ensure that vital microbial city inside your goats continues to thrive, supporting happy, healthy animals for years to come? Sometimes it's those little consistent things that often make the biggest difference in the long run.
And always remember, for anything beyond general understanding, for any specific health concerns, for diagnosis, or for treatment plans, your trusted veterinarian is always the first and most important call for your herd's health. They are your best partner in keeping your goats thriving. Don't hesitate to reach out to them.